Well, we're happy today to welcome Janet Hagerman to our studios, Patient Prism studios here in Tampa. Thank you for coming, Janet.
My pleasure.
And we're truly excited to talk to you about your work in the dentistry field for the last 3 decades and what you have accomplished in terms of fostering better communication between team members to allow to sell dentistry better, right? I thank you for sending me your book, which was Selling Dentistry. I think Robin gave it to me a few months ago, and I went through it, and I really was appealed by your vision of, you know what, if we fix communication in a dental office, I think we can fix all the problems, because everything starts at communication. Everything begins when, at Patient Prism, we've been saying this mantra forever, that what matters is how you make a first impression. Those impressions matter. When the receptionist answers that phone call for the first time from a new patient who has never called your office before, and they're fearful about how much it's going to cost. They're fearful about how much pain they might suffer, and they're calling you. They have made that an extraordinary effort to call your office, and now you have that person sitting in the front. Answering that call, and if that person doesn't do a great job and give that patient the respect that they truly deserve, because here you are sitting in an office who can actually make an impact on that patient's life. If you don't give them that empathy and respect and kindness and compassion, they're not going to book the appointment. And even if they do book the appointment somehow, eventually throughout the life cycle of that patient, they may not accept treatment. They may not be as trusting of you, because you've lost that trust with them right at the outset. So I'm excited that you're here to talk about how do you what is your approach? I mean, in the word selling dentistry may sound kind of inappropriate to many practitioners, because people think selling is a bad word. So what is your approach in selling dentistry? And you say you do it ethically, elegantly, and effectively, and then those are the 3 principles of selling dentistry. And so talk a little bit about that.
Right. Absolutely. Well, let me explain to you that, first of all, selling dentistry was really born out of a need in dentistry. It was actually the dentist who would say to me, would you please come and teach my team how to sell dentistry? Because I know dentistry is walking out the door. So you dentists, you may have said that yourself. I know dentistry is walking out the door, but I'm not sure what to do about it. Can you help my team learn how to sell dentistry? But don't call it that. Don't use the S word.
Right.
So I have found that more recently there's less resistance to the word selling dentistry, but for some reason in dentistry we have this uncomfortable, awkward feeling about the word sell. So when I decided to write the book to address those concerns, I wanted to add the tagline, and this sort of explains my philosophy. Ethically, of course, we're not talking about selling anybody anything they don't need or want, selling them a bill of goods.
Absolutely.
It must be dentistry that's been clinically diagnosed and documented. That's really important.
Absolutely.
So that's the ethical part. Effectively. We've all been taught that patient education is so important, but I have been guilty of this myself. Patient educate, you can tell, you can give your patient all this clinical information, and for some reason they just don't get it, or they walk to the front and they've forgotten it. Where did I go wrong? So the effective part of selling is when the patient actually says, yes, I get it, I want it. They accept the treatment, they book the appointment. Guess what? They keep the appointment.
Absolutely.
And then they pay for the appointment, and they're happy about it. They don't have buyer's remorse. So that's the effective part. And finally, a critical part of all this is elegantly. I want for the people that I work with, I want for all dentists, hygienists, assistants, front office, all health professionals to feel really good about what we have to sell. We live in an amazing age of incredible dental technology that we have in this country to offer our patients. There's no reason we shouldn't feel so proud of that and so excited about it. And so the communication techniques that I teach in terms of building relationships and how you make people feel in the office, those are the types of things that people should be excited about and happy about. Dentistry can feel sort of somber and serious. So to the effect that we feel very comfortable in our elegantly being able to present treatment and in all the steps that lead up to that, because that's really just the culmination. That's going to rub off on our patients. That's what patients want to feel when they come to see us. So that's sort of in a nutshell.
So where does it
what that's
start?
about.
Does it start with educating the team? Does it start from your standpoint? If a dental office wants you to come in and help communication and help teach them how to sell dentistry better, do you start with the entire team, from the assistant, from the front office to the assistants to the hygienist, to the treatment plan coordinators and the dentist eventually? Do you involve everybody in that process? Or is it just the treatment plan coordinators are important?
Great question.
Yeah.
Great question. Actually, it's the other way around.
Okay.
Start with the dentist.
Okay.
It
Top
really
down.
is
Top
top
down.
down, absolutely. And I like to work with the whole team,
Okay.
get the dentist buy-in at first so that they realize, yes, this is something that we need and that we want,
Okay.
and then work with the team. But actually, even though my part, that's what I'm good at, starting with that, it actually starts even before that with external marketing and what do patients see and feel like when they go in and touch your website before they've ever even met you. Why would they pick your website as opposed to somebody else's website? And to that effect, we know plenty of people that are very good at that. So that's something that I would, when I'm working with a client, I always look at their website and ask a few questions so that they can start thinking about that if they need help with that. But from my point of view, what I do is ideally I like 3 days to be able to go in and observe an office and listen to what they're saying, listen to how they're answering the phone, listen to how they're presenting treatment, but also listen to what do they just say throughout the whole appointment, what are their handoffs like.
Very nice.
All right, and then the second day have a workshop where we talk about all those different strategies. We talk about not only what do you tell your patient, but what do you ask your patient? We have a tendency to get so busy, tell, that we forget to find out what are your patient's values. What is your value based on your values? So if you both need a crown on the exact same tooth for the exact same reason in the exact same place in your mouth, but your value is different than your value, I'm going to present that just a little bit differently. So how do we know what types of questions to ask? And does this fit all personality styles? You and I talked earlier about diversity and different work styles of team members. Does this mean that if I'm rather a shy, more introverted person, that I won't be able to use this because selling is really for more outgoing people, which really isn't true at all. There are a lot of studies now that show the effectiveness of introverts, the power of introverts, and in many cultures, being an introvert is considered more of a leadership quality than in our country.
Right.
Okay? So the strategies that I teach that are communication based are effective. They can be taught to anybody. Anybody can learn this. And then ideally, I like a third day to again observe the team and see how they've begun to implement so I can help them course correct during the day. And then follow up with follow-up coaching as well, because we have a tendency to learn something, go to a course, come back all charged up and excited, and then the implementation falls by the wayside. So I like to be able to help people stay on course, whether it's Skype calls, conference calls, whatever. So that's sort of an outline.
That's really important. We've seen that, and I've been in dentistry for 2 decades, and I've seen that dentists are incredible at acquiring knowledge. They like acquiring new knowledge. They like to attend courses. And gather a lot of different amazing facts about practice management, clinical skills development, all the stuff. And what happens sometimes is when they come back to their offices, I think they get back in the routine. And sometimes the education that they have learned gets never implemented in the practice. And it stays at gathering dust. It used to be DVDs and books before, now it's all online. And you kind of get busy. And so the follow-up is really important. I agree with your stuff, is that you have to hold people accountable, because people want to be better. We've always seen that. Everybody wants to be better. whether it's obviously we know the dentists want to be, but every team member in your office wants to be a better version of themselves. And we just have to motivate them to be their best. I like one of your quotes, and I've said this all along, is that Patient Prism helps staff team members. We help facilitate their brilliance. And one of the things you had said as well is that I'm going out there to really showcase that every single one of you has an innate talent within you that I'm going to help you discover and develop. Because once you develop that talent, no matter whether you're selling dentistry or whether you're convincing your child to not eat candy, it's going to help you in all aspects of life.
Absolutely. It's those powers of persuasion, but I like to, what you were just describing, I like to call that growing your greatness.
Okay, nice.
Because I do think that we all have incredible potential that doesn't always get tapped. And so that's what I like to help people develop that incredible potential that they do have. And getting back to, the follow-up, I totally agree with you. I think that people do want to be better. They do want to improve. They do want to be their best. But we get back in our busy routines, and it's just so hard. I learned so much at that course or over this weekend. Where do I start? So that's where I think it's important to have a coach or somebody from the outside who's trained to help you take one step at a time and help the team as a group decide where do we want to start and come up with some sort of a game plan, because you can't implement all of this overnight.
Absolutely.
Right. So what makes sense to start first, and then perhaps discuss that at a team meeting, and then begin this first week we're going to focus on this. Next week, once we get that down where it's just second nature, it's comfortable, it's elegant, all right, it feels very natural, then we'll start something new. Because whenever you start something new, it's awkward.
It's hard.
You're going to try it,
there's some
and you're going to
inertia.
slip back.
Absolutely.
Yeah, that's just part of the process, the learning process.
Coaching, you see in any kind of high-performance activities, I think every single activity, dentistry is a high-performance activity. We just think we need coaches for athletes, or we need coaches for, we need good teachers at universities, but we really don't. And most, if you read the biographies of most successful people in business, for example, they've all had coaches.
Yeah.
And no matter what
Yeah.
level they were.
Yeah.
Warren Buffett has a coach. Bill Gates has a coach. Right. So it's so important for dentists and practitioners within the practice to understand that they're high performance athletes to an extent. They're working hard. They're doing amazing work in people's mouths. They're affecting lives, and they need to consider themselves as these performance athletes. And performance athletes need coaching because they need to get better at that. And I think that's what kind of your focus is to kind of be the coach for that dental team, and kind of look at each individual team member, look at their characteristics, look at their individuality, look at their ethnicity, look at their predisposition, whether they're introverts or extroverts, and kind of gear your coaching towards that. Because obviously at the end of the day, you can't, and that's why sometimes I wonder, people have scripts, you can't use the same script on every patient, right? This is what we're going to say when a patient needs scaling, for example. You can't say the same thing to everyone. Or you can't say the same thing to a woman versus a man in terms of accepting that crown that they have been ignoring to do for a long time. So we have to really understand, and I've said this for a very long time, is part of selling is moving people from a lower position to a better position, right? So how do you really motivate and move them to accepting, and how do you build that trust? So what do you do? Tell me, if I were to tell, I think building trust is the most important thing in life, obviously in business, because once you have earned the trust of people, they will do everything you tell them, and you will do that in an ethical way, because obviously part of building trust is behaving ethically. So what kind of specific techniques, or what do you do? Like, what do you tell team members? Like, here's how trust needs to be built with your patient. Trust needs to be built between the team members. Does it start with communicating better, or does it start with any kind of exercises that helps them build trust?
Okay. First, let me address what you said earlier about high performance
Okay.
in a dental office, because I think that's really important to acknowledge dental teams. They are high performance, from the dentist to the hygienist assistants. We are busy, busy, busy doing very important work, and that's highly clinical, highly technical, and then at the same time, we're expected to have all these people skills.
Right.
It's a lot to ask of people. And at the same time, that's the reason for good coaching. You're absolutely right. And there's, I like to say, if it's been done before, it's probably possible.
Right.
We know it's possible. So, so that's the first part of that. I just want to put that little acknowledgement for the dental teams and the industry as a whole, because I really believe in that. And trust is an interesting thing, because, you know, a lot of communication is not overt. It's not by the words we say. You know, you've heard it's not what you said, it's how you said it. So a lot of the things that we can do in dentistry that build trust don't even have to do with spoken communication. It has to do with how we make people feel. A lot of little things that instill trust. So specifically, for example, one of the things that makes people feel comfortable, have you ever been in a situation, let's say you were at dinner with another couple,
Okay.
and all they did was bicker with each other and criticize each other? I don't know about you, but that makes me uncomfortable.
Right.
When I'm with people that are constantly complimenting each other, it makes me feel really good to be in their presence, and I trust them because they trust each other. So one tiny little thing that's huge in a dental office is to be praising each other. I got to tell you, Dr. So-and-so is fantastic. She gives the best shots. You never feel them. Dr. So-and-so is wonderful. His work is so beautiful. You're going to love it. Our hygienist is great. Our assistant, we like to tease her that she's just great with scaredy cats, because our fearful patients, they don't end up fearful for long once, you know, they're with
Very
Suzanne
nice.
or whatever. But you want people to feel like, oh my gosh, I found the best office. These people love each other, and now I'm loving them too. So it's little things like that that build trust. Praise for each other. Another thing is how you do your handoffs. Do you even do your handoffs? Nothing's more uncomfortable for a patient than to be sitting in that dental chair and wondering, well, they left me here. I don't have a magazine to read. What are they going to do next? I know I thought I was here for a crown, but I don't. And I guess they're going to cut my tooth or something, but nobody's here, and I've been here for 3 minutes now. Of
Right.
course, they're going to think it was 30 minutes. It's just been
Right.
30 seconds,
Absolutely.
right?
Absolutely.
So it's really important that our patients never have to worry about what was the next step. So like the quick parts of a good handoff are introductions, so always introducing the patient to the next person you're handing them off to.
Nice.
Or if it's a patient that's a patient of record, reintroducing. Dr. Amol, I know that you remember Robin here.
Right.
And then what the main concern is, she's here today to get her crown prepared or whatever.
Okay.
The next step, we're getting ready to do that. Just as soon as Suzanne comes back to take a picture, we're going to be doing that, whatever. And then the next step. So if it's a handoff to the front desk, and Suzanne's going to be needing a appointment for periodontal therapy. So those 4 components. So do we need to repeat it over and over again? Yes. You know, because our patients forget it all. And it's interesting because when I'm a patient, I suddenly, the shoe's on the other foot.
Right.
I'm feeling like, I know they told me about that, but I think I forgot. What did the guy, I just had an implant. So, you know, I needed that information repeated to me, even though I'm in the industry.
And there is a tendency, sorry to cut you,
Sure.
there's a tendency among practitioners, any profession that is, that the patient knows as much as you do, because you've been doing this over and over again, so you're very comfortable with the information and the knowledge base. And sometimes you take it for granted, and the patient sometimes needs to hear it more than once. You're
Yeah.
completely right about that.
Yeah.
But what I like what you said about setting the stage for the appointment, setting the stage, and it could be nonverbal. You know, there's a lot of research in cognitive psychology about how do you set the stage before you make the pitch, right? And you're not, I mean, again, it sounds business-like that you're making a pitch, but at the end of the day, if you're making a pitch that's in the best interest of your patient, then don't worry about the language. Just worry about, am I saying everything correctly? Am I setting the stage correctly? And part of setting the stage is that positive atmosphere in the office. Everybody talks highly about the team members, each other, about the dentist, about the staff, and it creates that positive atmosphere. So by the time the patient is ready to accept that treatment plan, they have been surrounded with people from the time they called the office, from the time they looked at your website, and then they had that positive experience on the website. Then they called the office. They felt empathy. They felt welcome. They were told that we are going to take good care of you. So they felt that. So they made that appointment. They came in. They had a warm feeling when they got in. They were greeted hello. The room smelled nice. Very important.
Very important.
Aromas, right? Because you're creating setting up the stage for eventually a patient to establish trust, and it's nonverbal. Aromas are nonverbal, right? And then they go through the whole process. So I like what you're saying about having the nonverbal as important as the verbal. And people get busy. You're absolutely
Yes.
right.
Yeah.
It's some practices are so busy. They have. I mean, there's people don't have time to go. I have dentists tell me I have no time to go to the bathroom, right?
Yeah.
And I'm busy because we have 4 columns running, and there's no time to do this. But we need to take time out, right? And so what? So let's talk about that. Maybe the last couple of things is how do you when you go in and when you've done your program for 3 days, do you tell the dental practice and the team members that they need to devote some time every week to kind of look at what was said, look at, re-energize and understand what's important, because it's really important to have some time allocated to the team members to think about things and not just, okay, let's do this, let's do this, let's do that. Let's sit down quietly for 20 minutes every Friday or half an hour every Friday, and just let's talk about how are we addressing our patients, what are we doing, are we setting the right stage for case acceptance, are we making sure the patients understand all their options, are we making sure that the handoffs are good, and let's talk about it. And even if it's non-productive work, it's not non-productive because it does help, and as a CPA, I've been in the business for so long, and I have a hard time every time explaining to many of my clients about, guys, you have to not only just measure things that are visible to you, but it's also important to measure the things that are not visible. And because if you don't measure it, right? If you don't measure something, you can't really manage it. And Drucker said that, right? And so it's really important for that. The measurement's important, and sitting down with your team every week to discuss non-clinical, just communication things. And where do we stand? What do we need to do? So what do you recommend in terms of?
Yeah, I totally agree with you. What gets measured gets managed. So I do believe in tracking numbers because numbers don't lie. And once you know how to interpret them, that will help determine what we do clinically. One of my sayings that I love is production is a reflection of patient care. Increase your patient care, you'll increase your production. That's just the way it works.
Fantastic.
Okay. The other thing is I'm a firm believer in meetings, and I too have heard, I can't have meetings because it takes away from production, which is why I wrote a manual called Meetings Make Money, because if you do it properly and correctly and productively, you will not only make up for that production, you'll actually increase your production for many of the reasons that you mentioned. I do believe in monthly staff meetings, at least an hour, preferably 2 hours, and they need to be structured and have an agenda, covered steps, the types of things that we've been talking about. I believe in morning huddles, and those have to be very carefully organized so they don't get too long and get too long-winded.
Right.
And also, very important that a lot of people don't realize is having a monthly hygiene doctor meeting. Hygienists and doctor, this is a whole nother segment. You and I could have a whole nother interview just
Wow.
on that hygiene doctor partnership, how the doctor can help the hygiene and how hygiene can help the doctor increase production and patient care on both sides, both perio and restoratively. So the way you do that is you have to have time to sit down and talk. do case reviews, talk about your goals. What do we want to do? What is the new language that we want to use? And in terms of scripting, it may not be a script. I know a lot of people are anti-script right now, but I do think it's important, whatever you call it, to have some sort of a mental template so that you can adjust it and customize it.
Correct.
But so many times I've heard questions, what do you say about when the patient says, when my insurance won't pay for it? These are questions we hear every single day ad nauseum. So when we know, I would recommend you make a list. What are the most frequently asked questions that you get from your patients? And you make sure that you and your team all have an answer for that, a pat answer that just comes out naturally, that all of you are in sync, so you're all on the same page. And then, of course, you'll customize it, A, to your personality style. You may use a little bit different words. And B, to the patient's personality style.
Absolutely.
So, so you don't want to, I have a tendency to have a very overwhelming personality, assertive.
Right.
So for me, if I have a patient who's more demure in the chair, I need to tone down. I need to really pull back so I don't overwhelm that patient. So having those kinds of conversations at your team meetings, sometimes with a coach, are going to be really helpful so that once you get in the chair and you are busy, your communication can be very focused instead of sort of scattered. What do I do now? This question threw me for a loop. At some point, it should get to where there really aren't too many questions that throw me for a loop.
Absolutely.
At some point, you've heard them enough times. You should be very comfortable having those conversations.
So the last question, and I'll let you, I think, talk about. I'm really intrigued by the role of the hygiene doctor meeting. It's very interesting. I've always said in my past interviews and talks everywhere that hygienists need to be developed as leaders in practice because they can truly ensure maximum optimal case acceptance. They can ensure that trust is built because the hygienist spends the most amount of time with the patient and they have a relationship. And a lot of people trust their hygienist more than they trust anybody else. So it's very interesting that you talk about getting hygienists on the same page, and sometimes I've noticed over the years, and that sometimes there's no communication at all. The hygienists come in, they do their thing, and they go back home, and that's it, and that's they've done their stuff, and they go back home.
Yeah.
So really, how do you get them to buy into this? That hey guys, I'm gonna sit down with you and help you become a leader in this practice.
Absolutely, that's a great question. Thank you for asking it.
Sure.
I love it. First of all, I think it's real important that the doctor have a clear vision of how he or she sees how they want their practice.
Sure.
And also a clear vision of what they want their hygiene department to look like. Now, I realize many doctors may not know what their hygiene department should look like. I've had doctors say, I don't really know about perio and I don't really care. I just want to do my restorative stuff, but I know it's important. So you come in and you help me work with a hygienist and I'll just, I'll do it.
Sure.
I just don't want to deal with it because I don't know about it and I don't have time. So we educate together. But it's important that the doctor, and this is where a coach can come in handy, helpful to have an idea about what they want from their hygienist and their hygiene department. I want somebody to co-partner with me. Nice. I want somebody that's going to help sell the restorative dentistry because half of our restorative should come from hygiene.
That's correct.
I should be moving all that to my doctor. So I want a hygienist who's going to co-partner with me. Now, having said that, once that hygienist is hired, and there's all sorts of ways to make sure you structure your job description in a way that we make sure we get that special person that wants to do that.
Sure.
And then the doctor needs to be able to trust that hygienist. Ideally, the doctor should come in for a recare evaluation, and the hygienist should say, Dr. Amol, Robin's here, and we've done, and upon looking at her chart and looking in her mouth, I can see that from your treatment, plan. We still have 2 crowns that need to be done that are on the plan, and this one really looks like, I'd like for you to take a look at that right now. And I've already talked to Robin about it, and in the meantime, I've already talked to Robin about it. She's asked questions, I've asked for questions, and so we've had the conversation. So she is very ready to hear what you have to say, which hopefully is going to be, we can wait, or yes, it's time.
Okay.
So you and I, we want to, you're the doctor, I'm the hygienist. We want to have a real partnership. And the way we develop that is by sitting down and having just one-on-one meetings, looking at actual cases, looking at x-rays. What would you recommend in this case? This is what I would recommend. Are we congruent? Would we recommend the same things? So I'm very aware that in the states in our country, hygienists are not allowed to clinically diagnose. And at the same time, every hygienist that gets a license has been trained to evaluate and certainly make clinical recommendations, and we want that to be totally congruent with the doctor. The doctor always has the final say. But yeah, this can be such a strong partnership. It's like a dance, all right? You know, when you're dancing well, Dancing with the Stars, you know, you can tell that they practiced, and then their movements are, you know, it's almost like each one knows what the other one's
right?
going to do. It's synchronized, exactly.
Synchronization matters because consistency matters when it comes to patient accepting treatment.
Exactly.
They want to have consistent messages
throughout the whole team.
Exactly.
Exactly.
And when there is slightest inconsistency, they become skeptical.
And uncomfortable.
Right?
And that's where you lose your trust.
And that's what you lose your trust. So I think this is great. I like this approach of the dance between the doctor and the hygienist, because when that happens, I think you truly are building a great practice, because there is complete synchronicity between what's the communication between the patient, the hygienist, and the doctor.
And actually, that also extends to the whole team. Have you ever seen the Cirque Du Soleil or heard of the Cirque Du Soleil?
Absolutely.
You know, those amazing performers, you know, and you think, how in the world can they do that? They go flying through the air, they grab onto their hands, they swing together, and then off they go. And so sometimes, I wrote an article once called Cirque De Dentistry.
Oh, very
and
nice.
It was sort of comparing what we do, which can be life-saving, to that same thing, you know, how we work together as a team. How important it is to be synchronized. And when it happens, it's a beautiful thing.
It's a great analogy to dentistry, because you are artists at the end of the day. You are professional performance athletes, you're artists.
Exactly.
And when you combine that athleticism with artistry, dentistry is art and science both. It's the perfect combination. When you do that, then you have the Cirque du Soleil. And when people have that Cirque du Soleil moment, you look at it in terms of pricing. See what Cirque du Soleil did to the circus industry, right? Nobody wanted to pay more than $15 to see a circus. You are happy to pay $100 to go see O in Vegas or see the La Nuba in Orlando, because they elevated the game.
Yeah.
They elevated the game.
The experience.
The experience was all about that experience.
Yeah.
You know? They said, we're going to have a perfectly well synchronized team. We're going to have phenomenal music, live music for the first time. Lighting, everything, mood, aroma, all that stuff. And they created this industry out of nowhere. The industry didn't exist. And I think dentists can I think take some lessons from these guys on, okay, let's create the perfect harmony between our team members. Let's create the perfect experience at our office, and let's think of ourselves as athletes and performance athletes and artists, whose job is to basically make sure that we're delivering world-class dentistry, and when that happens, people are willing to pay the price. They're not going to say, oh my God, I saw an ad for $29 special somewhere. They're not going to worry about that, because they have now bought into your why. Right? Why do you exist? This is why you exist. You exist because you want to deliver great dentistry to the community, and
I
they
love-
have trusted them.
I love that metaphor. I'm really getting off on this metaphor of the Cirque de Dentistry.
It is
It's
absolutely
amazing.
phenomenal.
You know, we think of who is our competition. Is it the $29 coupon? Is it the office down the street? Is it big scary corporate dentistry? Or for big scary corporate dentistry, is it that boutique office down that can afford to maybe spend more time with their patients? But honestly, the competition is the big screen TV, jewelry, a new fishing rod,
Right.
our hobbies, our
Shoes.
vacations.
Shoes.
It's disposable income. Shoes, exactly. So I like to say that the people in this most of the people in this country have the money for what they want, whether they need it or not. In dentistry, our job is to help people want what they need. I was in the Apple store yesterday. My phone crashed. Boy, scary. Loss of
right.
technology. That store was crammed with people, all in there buying devices, looking for devices. So I like to say we have the money in this country for what we want, whether we need it or not. We don't need the next version of the iPhone, but we sure want it.
And it all stems from, and I talk about this as well, is it all stems because people want to buy an iPhone, the next one, because they really believe in Apple's culture. They have bought into that. It's not about, does Apple make the most technologically advanced phone? Probably not. The Samsung is more technologically advanced. It has
Oh, I didn't know that.
It has more features. But people buy into what Apple is all about.
Yeah.
They're about changing lives. They're about changing paradigms, and they're about they like that Apple is building a great building in California for $1 billion. It's self-sustainable. It's going to be unsold. So people buy into the values of the company, and because they're bought into the values, it really doesn't matter whether the iPhone costs $600 or $1,200. They're going to buy that iPhone X because they have bought into the values, and I can relate to. I am an Appler. People say I'm a Googler, right? I'm an Appler because I have all products Apple because that is part of my identity of who I am as a person. And if you can make your patients, and it's hard, obviously you can't compete with Apple in that realm, but to a smaller extent, if you can make people believe in what you believe in a small way, I mean, it could be a way that we believe that your oral health is going to improve your overall health. And that's our belief. And we believe that it's scientifically proven. And we want you to have great, enriched lives. And that's our why. And if you believe that why, then everything we do and we suggest to you is going to be accepted with welcome arms. And people are not going to worry about the competition. And Apple does worry about competition, but not to an extent that somebody else in that space would. They only worry about, are we the most innovative company on the planet? Do we have the best design on the planet? And people like that because I like the fact that the curves in an Apple phone are better than the curves in a Samsung phone. And it represents me because I am that perfection. I like that artistry.
So in a way, that metaphor is interesting because it's, Stephen Jobs combined the technology with the beauty of aesthetics. And isn't that what we do in dentistry? We combine clinical technology with beauty and aesthetics. And then the other thing that you touched on that was so important, your values, your beliefs. And that's what, talking about the selling dentistry, it is a process. Does it happen overnight? No, but it starts with those core beliefs, and once you have those core beliefs, that permeates through your whole practice. Maybe all the people that are in your patient base are not a good fit. There might be some that aren't a good fit, and that's okay. So that helps you identify and not be fearful of losing patients who may not share your core beliefs, but it's important to know who you are, what you stand for, is it oral systemic health, whatever, so that you can make sure that is what you project in everything that you do. So, and it's a process. It's like nature. It's like planting the seed and waiting for the harvest. The law of the farm. It's like the blooming of a flower. It happens gradually over time, and it happens easily and elegantly. So that's what we want to sort of strive for with selling dentistry. We want to have the process in place, and we want it to happen elegantly.
Perfect.
Makes
I think
sense?
it's perfectly said. I think we should end with that.
Okay.
Thank you. Thank you for this wonderful talk.
Thank you. My pleasure.
And we're looking forward to your listening to your webinars and your thoughts on this. This is going to be an exciting session.
Great. For me
So
too.
thank you so much.
Thank you.